So today we are very lucky to have 3 health and wellness champions who have joined today's conversation. As you can see from the pictures on your screen, they are very passionate about this topic in their own personal lives. We will begin by hearing from Shuma Pons, who is the newest Senior Program Officer at the Robert Wood Johnson Foundation, who provides program management and leadership for her foundation's Engaging Business for Health team. As a partner in helping ACCE's Education Attainment Division develop resources related to health and wellness for its members, she brings over a decade of experience in the areas of public-private partnerships for health, corporate social responsibility, and workplace and community health program development. She has also worked with various organizations such as the Global Business Coalition on Health, the U.S. Centers for Disease Control and Prevention, and the U.S. Peace Corps. She has also worked in over 15 countries, and this is why we are very excited to have her kick us off by talking a little bit about why health is critical to her foundation's work. So Shuma, I will now go ahead and pass things over to you.
Great, thank you. Thank you so much, Anna. Hello to everyone on the line. I'm so pleased to be here with you today representing the Robert Wood Johnson Foundation, which is a key supporter of the efforts that ACCE and EAD are doing around health and wellness and education and workforce development. So Anna and her team have invited me to share with you the Foundation's new vision of building a culture of health in America. And it's such an exciting vision, one that in fact drew me to the organization. I just recently joined as of a month ago, and which I'm sure all of you business leaders in your respective communities are going to get inspired by. So just by way of quick background, RWJF is the 4th largest foundation in the nation and the largest devoted to health. And 2 years ago, the foundation undertook a shift away from efforts to improve health that have focused primarily on the health care system to ones that recognize the fact that health is greatly influenced by so many complex social factors. And today we have embraced a vision of working alongside everyone in America to build a culture of health. We view this as a national movement in that we want to see health become a national priority, valued and advanced by collaborators from all sectors. The next slide. So what does it really mean to realize a culture of health? It might mean running a marathon once a year. For others, it may mean being able to ride their bike to school on safe streets, or children getting nutritious food at school. For all of us, it should mean going to see a healthcare provider who actually asks what your life is like outside the clinic. So this is a big country, and we fully realize it is made up of people who are going to define health in different ways. Next slide. But why does good health even matter? Well, good health helps everybody in our workforce thrive. As business leaders, you all know this well. Good health helps make businesses more competitive today and tomorrow. Investing in health helps build neighborhoods and cities with green space and public transportation. Caring about health means making sure our kids can enter school strong and ready to learn so they can be the workforce of tomorrow and the strongest possible talent pipeline. So we know good health matters, but why now? Why a culture of health now? Well, because the challenges are formidable. Today, too many people's health is tied to how much money they make, how much school they've completed, and the neighborhoods they live in. We all know that poor health impacts a business's bottom line. The CDC reports that losses in productivity due to worker illness and injury cost U.S. employers $225 billion annually. That's equal to $1,685 per employee. But poor health also impacts the workforce of the future. So some alarming stats, science tells us that 90% of a child's brain is developed by age 5. So those early years are critical. And yet, too many children grapple with poor health issues during these years. Everything from lack of nutritious food to substance abuse or violence in the home. Too many of our children are still overweight or obese. Ill health in childhood has serious ripple effects, impacting a child's ability to learn, thrive, and attain the highest education goals possible. And of course, this has impacts all the way into adulthood, hindering a person's ability to be a productive member of society. So what can we do? We need to start a movement from the ground up to change our culture into one that values health everywhere for everyone. And to do it, we need partners like each of you, colleagues who can amplify the voices of those of us who have traditionally worked in health and ensure that the message reaches everywhere. Some of you may be thinking that changing a culture based on a single idea is impossible, but we've seen it happen in this country with the environmental movement. What started out as a fringe effort in the 60s and 70s is today the green movement, which we all own and is a part of our day-to-day. That's exactly what we aspire to do with a culture of health. But naturally, we won't be able to do it alone. So to me, what is so inspiring about the culture of health movement is that it calls upon all actors, regardless of whether or not they see themselves as key players in health, to come to the table and deploy their own unique set of assets in service of this movement. Really, this means we need all hands on deck, including, importantly, business and business coalitions, from Fortune 500 multinational corporations to local mom and pop stores, to really embrace the message and join us. So what can people and organizations actually do to achieve a culture of health? What can you as business leaders, particularly in local communities, do? A few months ago, RWJF released an action framework for the culture of health, which you see here, and it's really intended to spur dialogue and collaborative action between individuals, communities, and organizations across the public and private sectors in the 4 action areas you see here. And it invites us all to find entry points relevant to our unique needs and goals. It's not a blueprint, but rather suggests multiple pathways for action. So I want to draw your attention to Action Area 2, which focuses on collaborations that include sectors typically viewed, quote-unquote, outside of healthcare. So this action area calls for more engagement from business, both in the realm of workplace health promotion and corporate giving. But importantly, this area also recognizes the links between the education sector and the health sector, which is really the focus of our webinar today, as Anna described earlier. So next slide, let's dig a bit deeper into the link between education and health, because that's what's really at the heart of our partnership with ACCE and the division. So everyone knows that better educated individuals live longer, have healthier lives than those with less education, and that their children are more likely to survive and thrive. But how strong is this link? So let's take a look. So male college graduates can expect to live up to age 79.7. That's a full 5 years longer than those who have not finished high school. For female college graduates, the life expectancy is 83.5 years versus 78.4 years for women who have not finished high school. Interestingly, education leads to reduced risk for disease. So an additional 4 years of education results in reduced risk for diabetes by 1.3%, heart disease by 2.2%, and overweight by 5%, and finally smoking by 12%. Other studies highlight education's lasting legacy on the health and success of future generations. So the infant mortality rate among children born to women who have never graduated from high school is 8.1%. That's nearly double that of women with college degrees, for which it's 4.2%. So we see that education leads to higher earnings and increased access to things like healthier food and safer homes. Better educated individuals also are more likely to have a job, one with healthier working conditions, better health insurance, and higher wages. So this really means we must look at education as an avenue to promote health and help reduce preventable illness and disease. It also means that the reverse is true, that investments in health and wellness will support stronger education outcomes, enhancing the workforce of the future, and ultimately our country's economic competitiveness. So by integrating health and wellness into its education and workforce development activities, the division is adopting an exciting cross-sectoral approach to build a culture of health. And this is an approach that we at RWJF really applaud and are extremely proud support. And so with that, let me move to how exactly the division is leading the charge in integrating a health and wellness agenda into education attainment and workforce development efforts. So EAD has identified 3 avenues or frameworks, which you see here on this slide, that chambers can utilize to engage in this type of work. We know there is lots of appetite from chambers to promote health and well-being, and so the purpose of these frameworks is to really provide ideas and entry points and really spur action. And later when we hear from Todd and Kelly, you'll be able to see real-life examples of these approaches in action. So the first is what we call Ready to Learn, and is really focused on children under the age of 5 and ensuring that they receive quality early childhood education and wellness care by the time they reach kindergarten. I think in some ways this could really be considered the most important area because it is really about setting a strong foundation for the workforce of the future. Second, we have workplace wellness, and that's often the first entry point for companies looking to get active. Everyone on the line is, I'm sure, well familiar with the benefits of employee health programs, both in terms of dollars saved in healthcare costs and in boosting employee morale and retention. And the third approach is healthy community culture, and it's about chambers joining forces with community stakeholders to improve healthcare access and enhance the quality of life for residents. Some examples here might include health fairs and awareness campaigns. The division has developed a number of tools under each framework, and as I understand, these are going to be ready soon, so keep an eye out, and I'm sure Anna will share more at the end. And there are some other materials that are already ready and available on the division's website, so I invite you to take a look there. And so with that, let me turn it over to our guest speakers who will share how they are really living health and wellness in their own communities and realizing a culture of health. So we're going to hear first from Kelly, and let me introduce you all to Kelly Bass-Siebel, who's the Vice President of Public Policy at the Santa Rosa Chamber of Commerce. And in this role, she oversees the Chamber's advocacy and workforce development efforts. And in her tenure at the Chamber, Kelly has played a really important role in the creation of the Santa Rosa Young Professionals Network, as well as the creation of the Chamber's award-winning Mike Hauser Algebra Academy and a widely recognized WHEEL program. So Kelly, over to you to share what you are doing in Santa Rosa.
Thank you. Well, Shima, I think you set the stage perfectly for the work that's happening in Sonoma County. Just so that everyone's aware of where we're at, Santa Rosa is the county hub of Sonoma County. Sonoma County is in the Bay Area, about 45 minutes north of San Francisco, in beautiful wine country. And with that, you can kind of imagine, we're known for our wine. We're in California. You can start to imagine maybe what our population looks like when you hear that one of our biggest industries is agriculture and tourism. Sonoma County has been working, and what I'm going to do is start with the broad framework of what's happening in our community and where the Chamber's played a role in that, and then also programmatically how we've played a role. And the overall community framework for health in our community is through a collective impact effort called Health Action. It started in 2007, and the vision was that by 2020 we would be the healthiest county in California. The vision of really what that means to be the healthiest has significantly changed since Health Action was launched. Health Action's a cross-sector group. The County Health Department is our backbone organization, and there's a steering committee that consists of business leaders, it consists of elected officials from the 9 cities within our county, consists of nonprofits, of healthcare providers. That group, which you can kind of see through that steering committee, has identified 10 goals to significantly change our community. They're measured by 22 indicators that are tracked through the Healthy Communities Institute, and they do span those 3. We touched on those 3. There's health, but then there's also education, and the third leg of that stool for us really is income. That's such a broad vision for a community that is diverse, that has 500,000 people in it, that is spread out geographically, and also really has diversity in terms of, we have some of our towns that are isolated. The strategy through health, education, and income really came about because we knew that if you don't have one, you're not going to be successful. You have to have those three things tied together. And just to go back to what Shima had mentioned about life expectancy and health, I want to paint the picture of our community. We did what's called a portrait of Sonoma County, and by we I mean that the county is a backbone organization that really looked at all the census tracts in our county. And we've got one, Bennett Valley, where the life expectancy there is 85.7 years. 2 miles away is the Shepherd community. The life expectancy there is 76.6 years. In Bennett Valley, 10% of the population is Latino. In Shepherd, it's 2/3 of the population. Bennett Valley has 4 in 10 of... Oh. Hello? Hello? Can anyone hear me? Someone put us on hold, maybe?
The line?
Yeah. You hear the music come on?
Yeah, somebody must have put us on hold.
Oh boy. I can try to...
I've just sent Anna a note.
Thank you.
Ellie, this is Alicia. Somebody put us on hold, so Anna's sending out a note. There we go.
Perfect. All right, awesome. Thank you. Okay, so where I was, Bennett Valley has 4 in 10 of that population have bachelor's degrees, well, less than 1 in 12 in that Shepherd neighborhood. The poverty rate in Bennett Valley is 6.6%. The poverty rate in Shepherd is 3 times that. And then I think it's important to note, too, that in Bennett Valley, there are 6 acres of developed park plus sports facilities. In the Shepherd community, it's 1 acre of developed park with no recreational facilities. When this study was put out, what it helped was these 3 initiatives under health, education, and income really start to focus their effort around place-based strategies. The 2 recommendations that came out of the study of this portrait of Sonoma County were, 1, universal preschool, knowing that if we can make interventions early, then that is going to play a picture into someone's life expectancy and in their, their income earning potential and in how they're going to do in school. And the other one is around anti-smoking efforts. We knew that these would be more successful through place-based intervention because the communities can look so different, because we can have towns in our county that are a little bit more isolated than others. The chamber itself participates with Cradle to Career very heavily. That was the area where we thought that we could make the most impact based on our expertise. The collective impact effort. We've sat on the operations team as a business member, bringing the voice of business while we work on education across our county with both school districts, with early childhood experts, and then with also the community-based organizations that sit there. We've been asked to come in, particularly around the economic wellness initiative, when we're talking about how do we bring the business community to the table. So this is a broad-reaching effort, and really the Chamber's role in this county initiative has been to be the voice of business. But along with that, we've also put our stake in the ground with where we think we can make the most impact. And so with that, we've developed a program. If we go to the next slide. With that, we've developed a program called WHEEL. WHEEL stands for Worksite Held Employee English Learning, but it's a lot more than that. I mentioned, you heard the statistics around the Latino population in areas of our county. You've heard what our major industries are. And what we continue to hear from school districts is that children don't enter kindergarten ready to succeed. The latest number I just heard is that 2 out of 5 of our kindergartners are actually entering kindergarten ready to learn. And that also, we've got, kindergartners aren't entering kindergarten ready to learn, but we also have an issue with parent engagement. And school districts are telling us that they can't get parents to come to meetings, parents aren't engaged or involved, and there was a lot of concern around parents, particularly those where English was not their first language, not feeling comfortable walking onto a school campus. The Chamber knew that where we could put our stake in the ground, where we could really help, was with employer engagement. That if employers considered themselves a partner not only with the school system, not only with education, not only with the healthcare system, but also with the employees that work in their businesses every day, then maybe we could make a difference. The WHEEL program works county-wide with businesses on parent engagement, on providing tools to that business that they can give to their employees that are going to strengthen what that workforce looks like. When we talk about the EAD's 3 areas, you know, the area that we feel we've become experts in is that ready to learn, because we know if a child enters kindergarten ready to learn, the chances of them becoming a successful member of our workforce 20 years down the line are much greater. We knew that, you know, really where does the business have control over that? As a parent of a toddler, I can tell you that if you're in a workplace where you feel like your employer supports the fact that you're not coming to work every day necessarily to be the best employee ever, you're coming to work every day because you want to provide a better life for your child than the one that you had, then you're much more likely to have higher productivity, higher morale, there's lower turnover, the attendance is usually greater, and since we know that the highest cost to business is usually around attracting and retaining employees and not having to retrain, that if they can keep employees in their workplace because they feel supported, particularly for, you know, working moms who are the largest growing segment of our workforce nationwide, that there's a much better chance that they're going to return to work. What we've done at this point is helps businesses identify what those family-friendly policies are. They're things like schedule flexibility, lactation accommodations. It might be law to be able to provide an environment for a woman to come into work and pump, but how are you having that conversation? Does that, you know, is somebody who works on the line in a factory, how are you making a space available to her? And the other piece, just to wrap this up, because I want to allow room for Todd and for questions at the end, is we've really partnered. We know that we're not going to provide services for everything, but because we do have that direct connection with business, can provide entree to other things in the community. So our county does an awesome worksite wellness program. When businesses ask me about worksite wellness, or when I'm in their meeting about family-friendly policies, we ask them, do you have something, you know, do you have a worksite wellness program in place? Would you be interested in it? And then we provide that direct connection to the experts that are already doing it that are not necessarily the chamber. So that's how the rubber has met the road for us.
Great, thank you so much, Kelly. I think what's really interesting about this work is, as you said, it fits very nicely in the ready-to-learn framework that the division has, but we also see how it fits into the workplace wellness, and what we're really seeing is the link between the two, and how, you know, any chamber's initiatives and activities can fit into more than one framework. So I'm sure folks have questions for Kelly, and we will have time for Q&A at the end, but let's move now to Todd. So Todd Shimkus is the president of the Saratoga County Chamber of Commerce, which has over 2,300 members, and prior to joining this chamber in 2010, he was the president of the Adirondack Regional Chamber of Commerce in Glens Falls, New York for 7 years, and vice president of the North Central Massachusetts Chamber of Commerce for 7 years as well. So Todd brings a wealth of experience in leading chambers of commerce. So Todd, over to you.
Great, thank you. So I'm going to talk about the Healthy Saratoga movement that we've tried to create here. Shuma mentioned the need to start a movement, and that's really what we think we've done in Saratoga County. Our efforts are probably, if you looked at that original slide, around workplace wellness and health, and then healthy communities and culture. So that's really what our program focuses on. The whole effort, to be honest with everybody, started, the discussion started in 2002. We have had a health insurance program through the chamber where mostly our small mom and pops and sole proprietors were able to get health insurance through the chamber. And for good or bad, I'm not going to get into the politics of this, we understood that Obamacare was going to drastically change that for us, which was going to drastically change our revenue stream, and that certainly has. And we were looking for some way to recoup some of those revenues, and did some evaluation and figuring out a way for the chamber to play a role in health and wellness is really what came out of there. So In January of 2013, we put together our first Health and Wellness Council to begin brainstorming with us. What would it mean? What could this look like? We had 25 people that initially sat down with us and started that brainstorming process. We really looked at two things. We figured out right away the mission, and you can see that on the slide. Ensure that Saratoga is one of the healthiest places to live and work, which is similar to what Kelly certainly is trying to do in California as well. The other thing we decided to do once we had that mission was, instead of focusing on maybe the weaknesses, we were going to take a look at our strengths. So we sat down and brainstormed what makes us healthy. And a few things that I'll throw out there that we thought were sort of unique and tell you a little bit about Saratoga. We're in Saratoga Springs, New York, so we're famous for freshwater springs. You can still walk around town into the parks right in our downtown area as well, and you can get you can sample, you can bottle, you can do whatever you want with the spring water that's there. Many of it has medicinal purposes. So one of the things that makes us healthy is that we have free spring water 24/7, 365, and so we put that on there. We're a dog-friendly community, which may not sound like it's healthy, but when you take your dogs out for a walk, you are active and engaged, and we encourage that here in Saratoga. We have sports groups to fit every possible interest that ensures that people get active. We're known for being a healthy place to come. Franklin Delano Roosevelt, for instance, came to Saratoga Springs, to the Roosevelt Baths buildings, the Lincoln Baths for health and wellness, and we still have many of those baths here. We have state and national parks, we have local farms, we have a history of dance. Dance is a really cool activity, and it's really healthy, and so that was one that certainly bubbled to the top. Public art, you have to walk to see our public art, you have to get outside to see it, and so we consider that one of the things that makes us healthy. And then we've got a lot of great workplace wellness programs here. Quad Graphics, which has its own Quad Med, is probably our best example of that. So we defined what made us healthy, and then we did what I think chambers typically do, is we figured we'd start with some events, because we could generate sponsorships and we could sell tickets and figure out what all of that meant. We could promote connecting within the community. And over the course of the last 2.5 years, because it really started in June of 2013, we created a calendar of events, signature events, 4 of them. In January for this year and last year, we did a health and wellness week, modeled a lot like restaurant weeks that many of you may have in your communities. But instead of visiting restaurants, we invited people to visit folks in our membership that offer health and wellness services. Some of them did free seminars, some of them did collaborative ventures and fairs, some of them did discounts on products and services, a whole wide range of different things. And we do that in January, obviously, because the hope is that we can capture some of that natural interest, some of the natural goal setting that takes place at the start of a year to introduce people to the local resources that might help them. The second one you'll see here is March, Healthy Saratoga Horse Basketball Tournament. Saratoga Springs has the oldest sporting venue in the United States. We are the summer place to be based on horse racing. We've been doing that here for 152 years, and I can't believe nobody here ever invented horse basketball, but we did. So in fact, our tournament is tomorrow, and we have 32 companies that do some kind of active event to select the person that's going to play for them. And then we play horse for a couple of hours tomorrow at the local YMCA to promote indoor activity as well as the outdoor stuff. Typically in March, we're still indoors here in Saratoga. This year, we can be outdoors right now. June is Employee Wellness Month, so we adopted a whole series of programs around that and events, walking events, running events, health fairs, breakfast on workplace wellness, articles in our local newspapers about steps that people can take as individuals or in workplaces to get healthy. All those types of things are promoted during Employee Wellness Month. We created, I mentioned dance. The National Museum of Dance is here. The New York City Ballet, the summer home for the New York City Ballet, is here in Saratoga Springs. So that history of dance inspired us to run the first ever Healthy Saratoga silent disco. I won't go into details on that, but it's an awful lot. It was an awful lot of fun and pretty unique for us to run here, and very active and engaging. We did that right in our downtown and had a lot of fun with that. So we created a Healthy Saratoga corporate pledge. We have over 150 companies. The pledge is both some specific suggestions on things employers can do, like inviting our Health and Wellness Council members into their workplace, healthy snacks, team activities, and stop smoking programs, and being supportive of employees that take those actions. 2, if you're an employer, you can fill out the bottom portion and tell us the other steps that you're taking, or the ones that you think are most important. We think we've had some impact. The New York State Department of Health in 2000, I'm sorry, I put the wrong dates here. In 2014, we were number 5 in terms of the 62 counties in New York State, and by 2015, we had come up to number 3. So we think we're making progress. And I guess I'll end with some, what's the benefit been to the chamber? Certainly for branding of the chamber. This has been a movement that has captured the community's attention. I can't tell you how many people, when we tell them what our mission is, to make this one of the healthiest places to live and work, they sign up right away. They want to be involved and engaged. It's helped us with new member sales within the health and wellness community. So fitness centers, acupuncturists, massage therapy, running stores, cycling events, farmers markets have all joined the chamber as a result of this. In the first year, we got one sponsor to come in at $25,000 to support the movement, and this year we're up to $50,000 from 2 different organizations sponsoring it. My guess is that that's going to grow in future years as we expand the movement. Branding for the community, we try to brand ourselves as a great place to live. If we're going to attract the next generation, being one of the healthiest places to live, we think will help us to attract young talent. And so that's definitely something we're actively engaged in. Our unemployment is right around, if not below, 4%. So we have a talent gap right now that we're trying to fill, and the Healthy Saratoga movement is part of that effort to help us recruit people to come here. And then economic growth. The health and wellness sector here is also one that's creating jobs. There's lots of entrepreneurs that are starting new ventures, and so we get to support those small businesses that are looking for our assistance to succeed, grow, and thrive. So that, in a nutshell, is our Healthy Saratoga movement. I'd end with one other piece. You can see our logo on this slide here. We did that sort of open source, so other folks that want to do healthy, fill in your own community's name, and off you are on your own campaign.
Wow, what a great example of building a culture of health. And Todd, as I was listening to you talking about spring water and dance and disco and horse basketball, I was like, I want to move to Saratoga. That was
the water's free.
So thank you both, Kelly and Todd. I think you've both shared really great examples of how local chambers of commerce can integrate a health and wellness agenda. And just a couple of things that I heard. So I think what's really interesting about these 2 examples is that they show different ways that chambers can engage. So Kelly, with your example, it was really about the chamber joining this larger group of stakeholders and being part of a broader coalition that is working towards health in Santa Rosa. And Todd, with hello?
Hello?
Yes.
Shuma, can you hear us?
I can. Can you hear me?
We can now hear you. You cut out for just a minute.
Okay, so not sure exactly where I cut out, but as I was saying, I think these are 2 really interesting examples that show the different ways that chambers can engage in this type of work. So Kelly, with your example, it's very much about the chamber being part of a broader coalition of stakeholders all working towards achieving a culture of health. And I think with Todd is a great example of a chamber really playing a leading role in driving activities forward. So that's just one thing that I wanted to point out, that there's different ways that chambers can engage in different types of activities that chambers can do. Kelly, with your example, really interesting how you really started with a data-driven approach, took a look at the numbers and took a look at where the numbers are not so good and where activities really need to be focused and directed, and then really came up with a place-based strategy. I think it's really important to ground everything that is being done in data. And Todd, with your example, great one of really playing to the strengths of a community. I mean, fantastic. Looking at what already exists in Saratoga and then really amplifying that and using that to build the image of a community. And at the same time, for the chamber, creating a new business model. So I think it's a fascinating example. So I have a couple questions for you both, and then we will open the lines so the rest of you can also ask what you'd like. So let me start off by saying you've both established and led these great health and wellness initiatives. What are the top 1 or 2 lessons you've learned or wisdom you'd like to share with the rest of the group? Kelly, let me start with you.
Sure. So I think for us, it's really been about process. You know, we've been working with government officials. We've been working with nonprofits. We've been working, and then we're also, we are working with the business community. And everybody seems to kind of move at a different pace. And it's taken us several years. You know, we started the WHEEL program in 2008, and so it's taken a significant amount of time to gain trust with some of the partners that we work with, and then also come to an agreement about what the end goal is. We know that we can't do everything, so we really picked what we could do well, what unique niche we had as a chamber representing the business community, who our members are, and where we can partner. And, looked at the things that were already happening, because there was already a community, worksite wellness initiative that was happening, and said, okay, we're not going to duplicate. We're going to look at where, we can add to, and not try to do the same thing as someone who's already doing it. And then really knowing that those partnerships ultimately strengthen both our program and then their program as well, and our community as a whole.
Great, thanks. I'm hearing a little bit of interference, so if folks could mute their lines, that would be great. Thanks, Kelly. Todd, how about you?
Yeah, I'll jump in with I guess 4 quick ones. First, I've always thought that chambers, the funnest part of this job is that we have the opportunity to convene groups of the best and brightest in our community across all the sectors to solve local challenges or to take advantage of opportunities. And I think the health and wellness field, as we've learned, is one of those areas where we can do that really well. The other piece that I don't think we recognized when we first went into this is that the health and wellness sector, I call them locally here, and I think they are in many other communities. As I travel, I look around to try to see, and I think this is happening everywhere. They are commercial space eaters and big-time job creators and entrepreneurs. So it fits right into the wheelhouse of what chambers ought to be doing. There's economic development in health and wellness. The third is, just to be honest, we've created some really good events. I can tell you the second year we've run every single one of these events, they did not look like the prior year. So we have adapted. Some were successful, others were not. And in the case where they weren't, we tried to figure out how to make them better, and we're doing that every year. What we've found, however, our weakness, if there is one right now, is we're connecting with employers and a piece of their workforce, but we're not really drilling down into the general community, that there's people talking about it, but we don't know that we've fully vested ourselves within and inspired individuals, either as employees or just people that live in our community, to feel as strongly about this campaign and movement as the business community does. So we need to figure that out, and that's why learning from other chambers and what you've done to really get into the community is important to us.
Okay, thanks for sharing that. Second question, so when you started to develop these initiatives, and I think this is really for any chambers that might be on the line or kind of thinking how they can do this, how did you start? I mean, are there any pointers or resources you wish you had at the beginning? You know, how did you kind of take those first baby steps, if you will?
You know, I can start if you'd like.
Yeah, please. Thanks, Kelly.
We really started by listening, and listening to our members. They were telling us that they were having trouble recruiting. They were, having trouble retaining employees. They were having trouble, particularly employees that were returning to the workforce after maternity leave. And then they were having trouble either with their employees communicating in the workplace. So when we started our program, I'll be honest, we did not start this as a wellness initiative. We started this because we were hearing our members say, we want our employees to be able to communicate better in the workforce, in the workplace. You know, if they're in a manufacturing company, if they're working out in the vineyards, if they're working in a hotel, we want them to be able to communicate with our customers, with each other, with their supervisor. And we started with English classes because we thought that's where we could provide value, and realized very quickly that the reasons that the employees were engaged were not because they wanted to be those better employees. They were there because they wanted to learn English to communicate with their child's school, so that their child didn't have to translate for them when they went to the doctor, so that their child was not translating financial documents for them. And we realized that if we had these employees that were incredibly isolated in their communities, they didn't know where to go for help, but they were still going to work every day. So if we could provide those resources through their employer, they would be much more likely to, one, feel supported if they wanted to go and ask for time off to go to their child's parent-teacher conference. But two, they also, started to look at their employer as a partner, and they felt like their employer believed in them not only as an employee, but as a member of our community.
Okay.
So I'll jump in. On our side, we started in January of 2013 with, I think, 2 or 3 different brainstorming sessions where we were just trying to figure out what could we do. We were encouraged, and we also did a film showing in our local theater of the movie Fat, Sick, and Nearly Dead as a way of trying to bring different people and the public into the discussion. At some point, we looked at the list, and we had like 80 different things we could do. And we sat down with a core group and said, all right, what's the one? What's one in there, what's one action that we can take? And that was about April of 2013. And the one we picked was a celebration of Employee Wellness Month in June. And then it was just figuring out, well, what events? And the method to that madness was we also wanted to find out by running a couple of events who showed up, what other companies, what other organizations would be interested. One of my favorite quotes is, the world is run by those who show up. So we wanted to create a couple of events that would allow us to see who wanted to help us decide where our world was going to go. And that's how we got into this.
Great. Okay. Okay, so I want to open up the lines, and I think we also have some questions that have come in through the chat, to the question box. So, Anna, let me turn it over to you and see if you'd like to read out those questions.
Of course. So at this time, for all of our attendees, we want to offer you the opportunity to submit your questions using the chat feature in the right-hand corner of your toolbox. Within your toolbox, you also have the option to raise your hand. So if If you're familiar with how to do so, go ahead, and I can also unmute you because I see the majority of you have entered your audio pins, so I can unmute you if you would like to present a question. So at this time, I'm just going to pause for a moment and see if any of you would like to present a question.
And this is Alicia. While we're waiting, I would love to ask both of our speakers, first of all, thank you so much for the great presentations and the really unique work. My question would be, are there any stakeholders who have gotten involved in your initiatives that really surprised you? Any kind of uncommon allies that have supported your health and wellness work?
I don't know at this point that I would call them an uncommon ally for us because they've become such a very close partner. But in the state of California, every county has First Five, which is funded through tobacco tax dollars and is a commission that really puts services into children aged 0 to 5. And they initially came to the table just, I think, to share their message about the importance of early childhood. You know, this was, again, back in 2008, 2009, when the conversation around early childhood didn't have nearly the momentum that it does today. And at this point, they've become a major funder. They view us as being their communication tool to the business community on sharing the importance of the first 5 years. So it's become a great stream of non-dues revenue for us, a really strong partnership. And we're now working with them on what it would look like to have universal preschool in Sonoma County. And they've come to the chamber to ask for the business community support.
That is absolutely.
I guess
Go ahead, Todd.
I was just going to say, I don't know about uncommon allies, but I think one of the things that has struck us and some of the other organizations is that nobody else here was doing this and trying to lead the charge. And to have the chamber step into the void as opposed to our Department of Public Health, or we have a really successful local YMCA with 25,000 members. They're a partner, but they didn't lead. Our hospital, our insurance companies, they're all participants, but nobody stepped into the lead prior to us. And I think we've looked back at that and been a little surprised. And then they've allowed us to continue to lead this charge. So they're happy to support it, and they're happy to leave us in the lead. So.
That's absolutely fantastic. I see Patrick, you have raised your hands. I'm going to go ahead and unmute you now. So Pat, would you like to present a question to any of our speakers?
I would. Thank you very much. I'm not far from Kelly in Lodi, California, and we also have a health and wellness initiative. I'm interested to know if we could find out from Kelly, either through her website or an email, what her 22 indicators are and her goals.
Sure, I'm happy. It's actually it's through Health Action has their own website, and I'm happy to go ahead and I can share that with Anna. I don't know if there's a way to get it out to the caller.
Absolutely, we can share it with.
Go ahead and send that along.
Thank you.
Does anybody else want to raise a question before we conclude today's webinar? Kelly, I'm not sure if I may have accidentally muted you. You would have to enter your audio pin for me to hear you. But Todd, if you want to take a stab at answering.
I don't know that I heard the question, though.
Oh, I'm sorry. It's what steps did you take to develop the strategic plan for the Health and Wellness Council, and how did you begin to implement the plan? So
I guess the quick answer to that is it was honestly a work in progress, still is. It's clearly the Healthy Saratoga movement has become a part of the Chamber's strategic plan, but at the time we put it together, it was sort of an all-inclusive, everybody was welcome to come to the table and help us define what we were going to do, and that's sort of how we've kept it all along. We invite non-members, public, private, nonprofit, anybody that's interested in the mission of Healthy Saratoga is invited to our council meetings, and whoever shows up that day helps us to define either how we improve the events or how we try to drill it down to individuals and employees going forward. So it's really just a work in progress as we continue to unfold it and figure out what the opportunities and challenges are. Wonderful, thank you. So I would like to thank all of our speakers on today's call and for sharing such wonderful examples of why health and wellness is such a priority for your community and how you're really leading the effort to advance opportunities to improve health for your residents. So one thing I'd like to do before we hop off the line is just share a few of the Education Attainment Division's resources that are available to all of you at any time. We have some wonderful consultants who work with our team to really help expand agendas related to health and wellness for any of our ACCE members. So if at any point throughout the year you would like to meet with one of them or connect, I can absolutely connect you with one of them, and you'll see my email listed at the bottom of the screen. Also, one thing that many of our members aren't familiar with is our Chamberpedia pages. We now have a new page on workforce wellness and community health. On that page we list a variety of resources and tools. And one thing you'll notice in the coming months is we'll be updating and reorganizing the pages so that they're more easy to access and that they're more intuitive when you're looking up a certain health and wellness topic. So stay tuned for updates on those pages. We also invite you to save the date for our annual convention this year in Savannah, Georgia. Our convention will be held August 9th through the 12th, and our division will be offering a full education and workforce development track with at least one session dedicated to this topic. And lastly, we are going to be expanding our resources, as I had mentioned, but we are going to be developing a specific toolkit related to these three approaches in which chambers typically engage in health and wellness. We're going to be vetting the toolkit with a small chamber task force to see how useful that toolkit is at the end of April. So in about the springtime, you should be seeing updates about that. Again, I just want to thank everyone for their time and hope you all have a wonderful day. Thank you.
Thank you.
Thanks.
Thank you.
Bye-bye.
Bye-bye, everyone.